Um, Thank you for being here. I'm Lisa Dubell. I'm the occupational health nurse at Life, and I'm here to give you more information on the coronavirus. Um, First, we can start with a video clip. It is quite explanatory. It's not in a difficult language. If there are any questions afterwards, you can ask me. Um, it's by a doctor, Dr. Lin. He's a GP, and he's from Canada. So he's done a lot of research. Especially with the coronavirus um, in China. So, yeah, we can start with that.
So we need to get the facts straight. How does this virus work? How does it transmit? Where does it want to go? And let's protect ourselves. I'm Dr. Peter Lin. I'm a family physician in Toronto, Canada. The coronavirus is a family of viruses that can cause as mild things as just a common cold, all the way up to SARS or MERS. These are these bad pneumonias
Thank you. Was that informative?
Yes.
Okay, are there any questions that you would like to ask about what Dr. Lin said? Was quite clear?
I
Yes?
just wanted to ask, what animal exactly was that those people ate?
I read that, yeah, what do you call it? A flairmuis? A bat?
And a pangolin.
Yeah. It actually, the host is a bat. And the coronavirus, this specific one, needs the bat to survive. It's not very concerned about the human. But unfortunately now, it spread from the animal to the human, and now, but it can now also be human to human. So, but to really survive, it needs the host, the bat, which, yeah.
Don't eat bats.
Sorry?
No, just don't eat bats.
Okay, I just want to give you a little bit of a synopsis of the situation in South Africa. I think that is where our concern lie, and we should be following, the development of the cases in South Africa. At the moment, or this morning, when I left home, it was on 16. Yesterday, they thought 17. There was that one case in the Free State that actually tested negative, and the minister corrected himself to say only 16 cases, and all 16 cases relates to traveling. So there hasn't been an infected or an infection in the community as yet, from somebody locally to somebody locally. What also happened yesterday was that the general of the World Health Organization, or the president, said that they now declare the coronavirus as a pandemic because it's in many, many countries. Usually when it's spread worldwide, they say only in, I think, Antarctic, it hasn't come in yet. But so it's a pandemic, and he also encourages all countries, to do that. As an example, China and Korea, how they actually managed the disease there and the spread of the disease, because it's now declining, the number of cases there, by using all these shutdown, quarantine, isolation. Businesses were not operating. People didn't leave their homes and all of that. But yeah, the economy suffered. But he says politicians should be less concerned about the economy at this stage, or countries, and just get this virus contained. So we'll look at the basic things that we as individuals can do to prevent us from contracting the virus. We can now switch over to the slide presentation. Okay, next slide. Okay, we first want to see how it spread. And this is definitely proven to be a fact, that it spreads when droplets that is coughed or sneezed out of an infected person's mouth or nose, say. Okay, so droplets mean it's body fluid, comes out saliva from the mouth or the nose. It's not something that just moves in the air around and it's transferred in the air. Droplets can only spread for about 1 meter to 2 meters, and it's from close contact between human beings. Okay, and then it can land on a person's face, mouth, and eyes. It's actually, you inhale it. Ne? inhale it, and then the eyes, of course, can also is very sensitive for any bacteria or organisms to enter the body or the bloodstream and then the body. Right, we can go to the next slide. So to protect yourself, keep a distance from people infected. Now we don't always know who's infected, but we can hear when somebody's coughing or sneezing, see that they're not feeling well. So yeah, it's, you know, I think if we all understand how droplets are spread, then people will also understand why I'm keeping away of a person who's coughing and sneezing. Okay, the next one. Then avoid crowds. I think we must be conscious about that. The crowds in the shopping malls, crowds at sport events. There are a lot of sport events already cancelled overseas. And big gatherings, supermarkets, church gatherings. Yeah, the ventilation in a church is not always good. Ventilation, certain, you know, you need fresh air, air circulating. So people who are infected, this is important, and I think this is where the tricky part comes in, is when people are infected but they don't show symptoms, but they can still transfer the virus. Okay, and then contamination of the environment, that is when droplets lands on surfaces. It's just an example of various items, but it can be even more than that. It can be like handrails. You go down staircases and you hold onto handrails. You share telephones. The mouse that you use, somebody else might use it. You know, in the factory wherever people work, I was asked the question, what about you know, the controls that they have to touch or work with, and then another person comes after them, and it's to clean it in between and to wash your hands regularly and to disinfect it with an alcohol spray. It's not using gloves specifically, because gloves can give you also a false sense of security. I think it's proper hand washing and washing of surfaces and so on will actually suffice. Okay, we can go on. How to protect yourself and other people. So here we are all in the same boat, I can say. So we all have to look out for one another, and if we know the principles of hygiene, personal hygiene and so on, then we can just follow that, and that is most times bacteria or germs come onto your hands. Hands touch everywhere. So wash your hands. Do not touch your face or rub your eyes with your hands. Sanitize with alcohol. That's important, base rub. And then, yeah, I think we just have to increase the number of times we wash our hands and be conscious of that. Okay. Then it's also important to know that the virus can live for a few hours to a few days on a surface. So if you wash that surface regularly, if you know a person's coughed or sneezed, wash it in between with warm water and soap. And it depends on the surface for the virus to survive. Some surfaces that are hot, it doesn't survive that long. If it's a surface that's made of plastic, it survives longer. So yeah, that's something that I just read the other day. The only effective, just the previous one, I didn't. Yeah, we said there, wash with soap and water and use a disinfectant. Okay, next slide. Thanks, Ross. what's the signs and symptoms? So, um, in my opinion, fever stands out. I think that's quite important. So, how do you determine whether you have a fever? Who can tell me?
Taste yourself?
You can measure if you have a thermometer. Okay, you get these digital thermometers that you can buy, and but you actually feel ill. With any fever, you feel your body aches, you feel warm to touch, and you're lethargic, you're tired. So yes, you definitely, that's the difference also between flu and a cold. With the cold, you don't really have a fever. But yeah, so why we say history of a fever is that you might have had a fever a day or two ago, and then other symptoms start. And then when you contact your doctor, you can say, the doctor will ask, what are your symptoms? You mustn't forget that you had a fever a day or two ago, so mention that as well. And then, of course, coughing, but there's also sore throat. The swab or the test that they do, they usually take a swab. It's not a blood or a urine test. In the beginning, they take a swab in the nose and the throat. Okay, and then, of course, together with the fever goes headache, and then a general feeling of malaise or feeling unwell. Any questions there on the symptoms? Okay, what must you do when you suspect that you've been infected? Not necessarily that you have symptoms. You phone the National Institute for Communicable Disease. That is our South African body, linked to the Department of Health, and they keep data, and they keep record of all infectious diseases that can spread from one person to another person. So that's a number, 0800 029 999, 4 nines at the end. Okay, and then they are open between 8 and 4. Keep away from public places, and then stay at home if you are diagnosed. Unless you are very well, you have to go to hospital. And then try and boost your immune system by, it's just living healthily and have a balanced diet, rest enough, avoid too much stress, and at work, I suppose it's not always so possible, but just try and eat a healthy diet and drink enough water, and then you can take supplements, vitamin C. I always recommend vitamin C at this time of the year to prevent flu, because we are nearing the flu season, and 1,000 milligram a day. It's a good thing. You can go to the next slide, please, Ross. That's the flu vac. Who of you have annual flu vaccinations done? One person.
Fatality points.
Oh, is that the reason? Okay.
That's what he says, but it's his wife who makes him do it.
Yeah,
Is it because you don't believe in the flu vaccination, or is it that you don't want an injection? Okay, now I can really recommend it if that's, I go every year for mine, and some people would say, I've had the flu vax and now I'm actually sick. And not in my experience, and also not the feedback that I get from other people that in my community or my friends. Okay, so the flu vaccination is not available as yet, but it's usually end of March, early April. You can go to Clicks or Dischem and your medical aids cover it, usually out of your insured benefits. So it is a preventative measure. It really, and the more you get it, the more you build your immune system, because there are different strains in your flu vaccine every year. Comes from the northern hemisphere, and yeah, we are vulnerable because we don't know what to expect from the northern hemisphere. Okay, this winter. Let's go to the next slide. Then here are now the people who can get very ill. Well, I won't say that it will definitely happen, but I think also the statistics show us that most of the cases with the coronavirus infection, they were older than 65. They were people with underlying disease, like lung disease especially, chronic kidney disease, cardiovascular diabetes, people with cancer. Okay, makes sense. The gentleman who's in Gauteng in Charlotte Matseke Hospital, he's 55. He's very ill. He's actually critically ill. And he had an underlying chronic kidney disease. And Tom Hanks, you know that he's infected. He's an actor that you know. And he is a diabetic. But it's just an example. You know, I don't know all the cases. So yes, I think that's almost the end of the slide presentation. We can go to the next slide. I think there's no next slide. Are there any questions? Yes?
How long does a test take if you go for a test to get the
Oh, it's
results?
very quick. Oh, to get the
Yeah.
results. It's a PCR. They say it's about 84 hours, 2 days. There
48
was a
hours.
person now tested at APSA. I just heard over the news coming here. Bank, and he was in contact, and they're waiting for his test. They sent a lot of the workers home.
Okay.
So yeah,
And is everybody equipped to do the test? Or how do you?
I'm not sure. I think Lancet and AMPATH could have their own, special unit for that.
Okay.
Because that is what the World Health Organization person said. The protocols for the testing. The more laboratories have it, the better. But the Department of Health have got a national laboratory. I think for statistics and so on, they communicate with one another. But the test costs in the region of about 800 to 1,000 rand. And some medical aids say that they cover it, the test. I got from Discovery Health a SMS to say that it's covered.
I heard a comment this morning that South Africa is the only country that's charging for these tests.
Yeah, I had a question also this morning. Why doesn't the government pay for the tests? And just anybody who asks for a test can have a test. So that's difficult, because how do you now test a population of 50 million or more people just on a random basis, and in 5 days you test again, and in 5 days you test again, because it's not like the HIV virus. The HIV, you know that it's in the body and you test and so on. Because with flu, this is a type of flu, the corona, but it's the fact that it's so unique. In the first place, it's a new virus. They don't know much about it, and our bodies are not immune to it or used to it. We haven't got antibodies. So it spreads very fast. That's another characteristic of the virus. It spreads fast and easily. I can be in contact with all of you You could all have the normal seasonal flu, and I'm not going to get flu. But with the virus, the coronavirus, they've now said it's like the one they call SARS in 2003, which is the serious acute respiratory syndrome. Dr. Lin also referred to that. So, yeah, it's just different.
So, I'll ask my question in a different way. Italy, Germany, and America, do they charge for these tests?
I don't think America do. Europe does. They do charge because there's a big boo-all that they stopped going personal. Because he's a clown.
Is this equipment?
Yeah, I don't know. I must actually find out, but you know,
Just putting you on the spot, but that's just a
India.
question. Yeah.
I can think
don't
where
make
there's
any
the
difference
National
anymore.
Health
Yeah.
Service.
Ask your
You know, like in England, I suppose you know that they don't charge, the UK, the National Health System. I heard the finance minister's budget speech, and he, you know, they are really helping the community, the people financially who can't work because of that, who can't go to work. Those who have to be in isolation or quarantine, and yeah, with sick leave, with yeah, it's paying for medical costs and things like that. So I'm not so sure the benefits in South Africa, you know, when it comes to the testing. They should actually pay for it, I would say, but because you want to, that's part of your control program and preventative program. But just as I don't know if I've mentioned this, but out of the 16 people that have been confirmed cases, they have tested over 4,000 people. So the contacts were traced of these 16 people, and then they were tested.
So now, who's paid for all of this?
That, I think it could be the NCID, you know, the health department.
So now, in the case of, let's say, like, I don't have medical aid and whatnot, and I kind of feel like I have these symptoms, what are they going to do?
I think the government will pay.
They will pay.
Yeah. They will use the National Health Laboratory Service, and that's free.
If you contract it and you're cured, can you get it again?
Yeah.
Is it?
Reinfection is
So
possible.
reinfection, okay. So it's like a normal flu. Okay.
But does that mean you'll have
Yeah, yeah.
antibodies or?
Yeah, you develop antibodies, but
immune,
not
yeah.
enough. Yeah.
Okay.
But with flu comes and goes. So will this thing also come and go? Let's say everyone has been cured of it, will it just all of a sudden just come back now? So it's here, it's here.
Yeah.
I think it's here, it's here.
But yeah, it's like with all these different flu strains, you know, like if your vaccine has got like 3 or 4 strains. Next year it might be a little bit different, but we can get it again. And with the cold, there are even more strains. I think the reinfection could be with fewer symptoms. There are a lot of people who are infected who don't have symptoms, like they said, but you can still transfer the virus. Like children, children seems to not develop aggressive symptoms. If you're under the age of 16 or now 12. Yeah. So in the UK, they're looking at closing schools if the cases increase and from the age of, I think, 14 or so. Yeah, it's very, remember it's just a new virus, and we just look at examples and we sort of see what the stats show. And you can keep track of the South African situation, but we learn from the overseas one. But it's important for us to be aware of the fact how it spreads and how you can prevent that you get infected and then you infect other people. And if you have symptoms, what to do, but you don't know, always if you've been in contact, but if you know somebody was coughing and I was in that area, yeah, contact the NCRD even if you just have questions. That's my advice. Okay. Money. They say this morning that rather use your bank cards than to use coins. Yeah. Because how do that person used it, that person, and I mean to wash each coin before you use it. I think doesn't make sense.
That's what SARS does already, they wash the coins.
Yeah.
So no
That's the
shaking
SARS
of
way.
hands. You don't even shake hands there. No more shaking.
Yeah, you don't shake hands. They stop shaking hands or kissing. Yeah, you know, it's. I was standing in a queue the other day, and I thought to myself, you know, I should change the time that I go to a shop. Change it when I think it won't be that busy.
3 o'clock in the morning.
Yeah.
Everybody goes for bread and milk afterwards.
Yeah.
Yes.
So that's
Next month.
Okay, thank you very
Thank
much.
you.
If there are no more questions, then we can